Hello, my name is Tiago and I will present this iShow with the title of Pharmacokinetics and Medicine Management in Geriatric Nursing, and I will present a teaching framework. Why focus on pharmacokinetics and geriatric nursing? We know older adults experience significant physiological changes that profoundly affect the pharmacokinetics of medications, specifically in the areas of absorption, distribution, metabolism, and excretion, ADME. These changes are largely attributable to age-related alterations in organ function, body composition, and the presence of comorbidities which collectively contribute to an increased risk of adverse drug reactions, ADRs, and drug-to-drug interactions, DDIs. Understanding these physiological changes is crucial for healthcare professionals, particularly nurses, who play a pivotal role in medication management for this vulnerable population. The aging process is associated with the decline in renal function, hepatic metabolism, and gastrointestinal absorption, all of which can lead to altered pharmacokinetics. For instance, studies indicate that renal clearance decreases with the age due to the reduction in glomerular filtration rate, GFR, which can result in accumulation of renally excreted drugs and their metabolites, thereby increasing the risk of toxicity. Additionally, hepatic metabolism is often compromised in older adults, leading to prolonged half-lives of drugs that are primarily metabolized by liver. This is particularly concerning for medications with narrow therapeutic indices, where even slight alterations in drug levels can lead to significant clinical consequences. Moreover, the distribution of drugs in the body is influenced by changes in body composition, such as increased body fat and decreased lean body mass, and total body water. These alterations can affect the volume of distribution for hydrophilic and lipophilic drugs, leading to unexpected drug concentrations in the bloodstream. For example, lipophilic drugs may have an increased volume of distribution, resulting in prolonged effects of potential toxicity, while hydrophilic drugs may exhibit reduced VD, necessitating dosage adjustment. The phenomenon of polypharmacy, which is prevalent among older adults due to the management of multiple chronic conditions, further complicates medication management. The concurrent use of multiple medications increases the likelihood of TDIs where one drug may alter the pharmacokinetics of other, leading to either diminished therapeutic effects or enhanced toxicity. This is particularly problematic given that older adults often have altered pharmacokinetics profiles that can exacerbate these interactions. For instance, the metabolism of thyroid medications can be significantly affected by other drugs, necessitating careful monitoring and potential dosage adjustments. In light of these complexities, it is imperative to equip nurses and other healthcare providers with robust understanding of pharmacokinetics and the unique challenge associated with medication management in older adults. This fundamental knowledge is essential for ensuring safe and effective medication administration, minimizing the risk of ADRs, and optimizing therapeutic outcomes. Nurses must be adept of recognizing the signs of potential drug toxicity and understanding the implications of polypharmacy, including the need of regular medication reviews and the potential of deprescribing unnecessary medication. Furthermore, the implementation of comprehensive medication management strategies, including regular assessment of renal and hepatic function, can aid in identifying of patients at risk of adverse effects. For example, analyzing this article that I wrote, we can see some of the areas that are highlighted and specific for older adults. For example, the absorption, altered gastric pH, and slow gastrointestinal motility, the distribution, increased body fat, decreased lean body, metabolism, excretion, as discussed already, the challenge of polypharmacy, as we already indicated, the impact of limited clinical data, strategies for optimizing the prescribing, and the clinical implications and future directions. Later on, you will have the link if you would like to read furthermore. So due to all of that, it was imperative to create a framework to teach student nurses the importance of the risks for this population. So by 3 steps, first in the theory and the conceptual foundations explaining the pharmacokinetics, then implementing a program of simulation scenarios where applying knowledge in realistic case studies, and later a time of the students to debrief and simulate all the knowledge acquired with time for reflective practice, where they will analyze the outcomes and adapting strategies. It is important to empowering nurses for safer geriatric care, understanding pharmacokinetics enhance medication safety for older adults. The teaching framework bridges theory with practical applications, and the future plan will be to broader implementation and refinement based on the feedback that we are collecting at the moment. We are not here to curse the darkness, but to light the candle that can guide us through that darkness to a safe and sane future. John F. Kennedy, 1960. And this quote still up to date. This is the reference, namely the article that I mainly use. Thank you so much for your attention. Thank you. These are my details. Any queries or any comments, please feel free to contact me on my email or my ResearchGate profile. Thank you.